I've been practicing doing like these for about 7 years since I started full time, and even now, it's really hard to do an ace wrap well on a transfemoral level, just because it's a more soft tissue, dense area. It doesn't really have as much bony landmarks for you to be able to get like a hug in on, so that it just is notorious for falling off. So, for the purposes of just getting the psychomotor skill down for now, try it on the transtibial side first. The other thing that makes it really tough to practice on the transfemoral side on these dummies is that they do not have hip abduction range of motion or flexion range of motion, because if I am trying to ace wrap on a transfemoral side, I'm constantly asking the patient, can you lift, bring it out to the side, roll a little bit, and so that just makes it tough with these dummy legs as well. So I'll show you the technique that I found that seems to work the best for the widest amount of people. It is by no means the only way to do it, but the general things that we're always looking for is sequential, graduated compression, starting distally and moving proximally, since we're trying to promote fluid movement out of the distal end of the residual limb. We're looking for an adequate amount of tension, and kind of in that Goldilocks range. Not so loose that it falls off or has tons of gapping, but not so tight that we're causing pain or concerns with skin integrity or vascular compromise. Try not to have any significant bunching or wrinkling of the layers as you add them. Now, some small folding or really small amounts of bunching, unavoidable sometimes. So I don't expect it to be wrinkle-free 100%, but I'll show you how we try to minimize them. And then for the transtibial side, Dr. Umberetta and I both agree that if we're still in the ace wrap phase of applying compression to a brand new residual limb, we do not like to apply the ace wrap up above the popliteal fossa, because with ace wrap figure eighting, there ends up being so many layers that it can cause irritation back here if they're trying to go through knee flexion range of motion. We'll see in a little bit that the shrinker does go above the knee, but it's only 1 to 2 layers max of fabric there. So it's a little different. Okay, so my personal preference as I get started is I start with the roll on the underside, but it's only temporary, and it's gonna end up on the top side for the remainder of the wrap because it's easier if it's on the top side. So I go from front to back once, and then I tack with a C handhold, 1 on the top and 1 on the bottom. And then what I like to do is I fold away from whatever hand is holding it, so I end up with a little 90-degree turn there. And then 1 time around, not trying to pull a lot of tension here, just trying to anchor itself in place so that way I'm not feeling like I need 3 hands. If that little 90-degree turn messes with your head for whatever reason, then you can certainly start with the roll on the top, anchor with your C hold again, and then just pull it to the side without doing that little flip as well. Both are acceptable as long as you're trying to minimize rolling. Okay, so now I've got this capital T shape. My next goal is to come down and get distal corner coverage. What a lot of people get messed up on here is that they're trying to cover the entire gapping area that they have in 1 layer. But the reason that we don't want to do that is because then we end up with actually a bigger gap of coverage at the very bottom of the limb, and so we want to focus on coverage there first. If we end up with a little bit of gapping higher up the limb, we'll cover that with subsequent layers, okay? So another way you can think of it is wherever this layer ends, you want to try to hit it with the middle of the layer that you're adding on top of it, okay? Now, if I try to go from 1 corner to the next in 1 fell swoop, I often end up with kind of a weird gap, and I found that it's more likely to fall off. So just for this first layer, I come back up to the top and then catch the next corner on my way back around on the next one then. So for those 2 corner layers, I have a really small gap between the 2 of them. Now that we've got corners covered, The remainder of the wrap, I'm just doing that alternating diagonals with the figure 8, and I don't have to do that like in between up top any longer. And so I'm looking to cover about 50% of the layer that was on that same diagonal. So here's my previous layer, covering it by 50%. So that way you end up with this cross-hatching pattern developing up the leg. So depending on the combination of this, the circumference of the residual limb you're wrapping and the length of the A-strap you're using, one A-strap may be plenty to give you sufficient coverage. I got corners covered and one additional layer on each side, so that's pretty good. I could stop there. If this A-strap had run out like right there instead, I'd want to add a second one on to continue working my way up the limb. So I'll add a second one now just so y'all can see what that would look like. And so then again, I'm just going for that 50% overlap with the previous layers. So for this limb, not that the second one was super necessary, but I was still able to get it to end before the popliteal fossa and keep working my way up the limb. Whereas the other thing we see oftentimes is people will wrap up and then they'll come back down to the distal end and then work their way up again. So any questions on that?
I have just one question.
Yeah.
So with here, we don't add the anchor strap around the knee so that it doesn't fall off. I don't teach that.
That's not our preference.
Okay.